if it depends on which program you go into. So let's start with the outpatient program first. If you are a court diversion, and we have both adult diversion as well as adolescent diversion. So if you're a court referral, it's an 8 weeks program that you follow with us. It's individual therapy once a week and group therapy once a week. After that period, we also test you. And we do random urine testing because that is the proof that you need for court to say that you have, obviously you've stayed clean and that you are now willing to change. Then we write a court report and that goes to the probation officer. And then through that process they are able to say either you have a lighter sentence or they decide that they're going to drop the charges against you, depending on how severe the charges were. So that's our diversion on that side. We also have then the normal adolescent program on outpatient. So that is for children who have been caught at school or their parents have caught them smoking at home or doing something that they weren't supposed to do. And they then also refer to us for an early intervention program. So what we try and do is through drug education, through self-awareness, we're trying to look at building up resilience to drug use. So we're saying these are the dangers. Make an informed decision about how do you want to live the rest of your life. How will this impact on your future? So that is part of the adolescent program we offer. Then if you look at our adult outpatient program, that is now more for the guy who is what we call a functional addict. It's a person that can keep their job, they still have their family going, the drugs haven't impacted so much on their life that they've lost everything, but they're in the process of losing it. So it's either through the workplace that they are referred to us, where there's already a disciplinary process, and they need to now make sure the person as part of that disciplinary is helped with their problem. Or it's an individual that decides, I've had enough and I need to do something about this. This is starting to impact on my life. And then they also come and see us once a week, as well as for group sessions that they attend with us. The group sessions are very important because we believe that it's creating positive peer pressure instead of negative peer pressure with the drinking and the drugging. So you learn from other people, how are they doing it, how are they staying clean, how are they handling difficult situations or problems in their life. And that is the whole aim of groups, why it's so effective in substance abuse. Because it's constantly not this somebody high up telling me this is the way to stay clean. This is actually coming from people who's been there themselves and are doing it themselves. So people tend to listen more to each other than to a professional only that sits and tells you exactly what you need to do.